A new global study finds the rate of high blood pressure in kids has nearly doubled in 20 years. Data showing about 3.4% of boys and 3% of girls had high blood pressure in 2000. Since then, it's jumped to 6.5% in boys and 5.8% in girls. Joining us now, Dr. Scott Hadlin, Chief of Adolescent Medicine at Mass General Brigham. Great to see you as always.
Good to see you too.
All right, Dr. Hadlin, you looked at these global numbers from the study. How do we know, or do we know, how the U.S. compares?
Yeah, we're about the same here in the United States as what we're seeing globally. The sad truth for global health is that unfortunately for a long time in the United States we had much higher numbers, and the rest of the world has actually caught up, probably as they've adopted diets similar to ours and lifestyles similar to ours. And so our numbers look like the rest of the world. What it looks like right now in the United States, if you dive into these numbers or other studies that are out there, is about 1 in 10 young people has a blood pressure that we would consider sort of too high, and then about 1 in 25 has what we would actually call hypertension, meaning that your blood pressure is so high that we would potentially put you on medications. And 1 in 25 may not sound like a super high number, but if you think about it, that's one child in every single classroom across the United States when you average it out.
So Dr. Hadlin, does the high blood pressure in kids cause different risks than adults, the same, any symptoms?
We worry about a lot of the same things in kids as we do in adults. In particular, the kidneys and other organs are really sensitive to high blood pressure. And so we look for some of the same symptoms and concerns in young people. But the real concern is that if you think about the single leading cause of death in the United States among all Americans of all ages, it's cardiovascular disease, right? And one of the single leading contributors to cardiovascular disease is high blood pressure. And so it's really important for us to identify high blood pressure as early as possible in life and to address it as soon as we can, because when we do that, we prevent lifelong harm and we promote, health and well-being across the entire lifespan.
So you mentioned some of the factors that may have led to this worldwide. What changes need to be made? Are we talking about diet, exercise, stress level? What changes?
Yeah, it's kind of all of the above. I mean, one of the key things that we need to do, and I care for a lot of patients with hypertension in my practice, one of the key things that we need to do is help young people who might be overweight or experiencing obesity to bring their weight down, because when we do that, often their blood pressure will go down as well. And so what that means is that we're often focusing first line on diet and exercise, and specifically with diet, it's not just reducing portion size and sort of eating healthier, but specifically also trying to avoid ultra-processed foods, salty foods, which often can raise blood pressure, fast food, which has a lot of salt in it. But first step, talk to your pediatrician if you're worried about your child's blood pressure, because we're here to help.
All right, Dr. Hadlin, as always, thank you.
Thank you.
Have a great weekend.